California Governor Gavin Newsom declared a state of emergency yesterday in response to bird flu that's spreading among that state's dairy cows. The virus has already caused the deaths of more than 120 million birds across the country since 2022. Stephanie Tsai reports now from Colorado on efforts to keep the dairy workforce safe, given concerns that the more the virus spreads, the greater the possibility that it mutates to allow spread among humans.
In this stretch of rural Colorado, Soraya Leone is a lifeline for many agricultural workers.
The farm workers and dairy workers, it's very hard. It's very hard to survive.
She's a community health worker with Project Protect, part of a statewide nonprofit.
Que corresponden a cada uno.
Her regular visits and food deliveries to farm workers in need now includes a bag full of face shields and masks, the equipment that protects them from bird flu. Since the spring, avian influenza has been spreading in dairy cattle and has infected about 60 farm workers nationwide. Despite the risks, this worker said he's gotten little information from his employer.
The owner, we never see him. They're not interested in us.
Speaking to us anonymously because he is undocumented, he told us earlier this year he was ill and had conjunctivitis. Commonly known as pink eye, the symptom is a sign of possible infection from this strain of bird flu.
On a statistic, we don't have too much people sick from this fever. But on the reality, many people got sick, but they never know because they never had information about what the symptoms are or how they feel.
Leone is part of a network of so-called promotores, established during COVID to help spread critical information to Colorado's many Hispanic farm workers. Lately, the Promotora network has shifted to addressing the threat from bird flu. Did workers get enough information when bird flu started circulating in this area over the summer?
Not really. The government response was too late. They know they have the sickness because the symptoms, the eyes and the cows. So now they know they got this sickness, but only because we provide information later. No before.
In addition to groups like Project Protect, a federally funded agricultural health and safety center at Colorado State University has been using social media to provide information to workers. While the virus, known as H5N1, has killed more than 100 million poultry birds and tens of thousands of marine mammals, in cows it has been less deadly, with most recovering after experiencing a drop in milk production. While at least one person has been hospitalized with bird flu, this recent strain of the virus circulating in cows has been relatively mild in humans, and the risk to the public remains low. But Colorado state veterinarian Maggie Baldwin and state epidemiologist Rachel Herlihy are watching the changes in the pathogen closely.
We've seen this virus move from species to species before. We've seen spillover of this virus from wild birds and from poultry to mammals, and particularly that's been wild mammals in the past. What's concerning is the mammal-to-mammal transmission of the virus right now.
While pasteurization has been shown to kill the virus in milk and dairy products, workers coming into contact with raw milk are at risk.
We know that the more opportunities that we give this virus to be exposed to people, the more opportunities it has to adapt potentially and then gain that ability to potentially spread from person to person. And that's, of course, what we want to prevent.
Since July, Colorado has mandated weekly bird flu testing of bulk milk samples from its licensed dairies.
Every week, we've seen fewer and fewer positives, which is fantastic news. But we really don't know what the long-term impact of this virus looks like. We know that, yes, the dairy cows do seem to build some level of an immune response, but we don't know if an infected herd could become reinfected. And dairy herds are constantly bringing in new replacement animals all the time.
Over the summer, more than half of the dairy herds in Colorado tested positive for avian influenza. While there hasn't been a positive case since August, there's still concern about dairy farm workers, many of whom are undocumented immigrants.
There really is very little support.
At a Mexican restaurant, we met one longtime dairy worker who also wanted to remain anonymous because of his immigration status. Have companies given the right protections to farm workers to keep them safe?
There really weren't any measures taken. The only measure to avoid infection was when they washed the tires of the trailer trucks that arrived to drop off the feed. But as far as the personnel, I never saw them wearing any protective gear to avoid infection.
He described a friend who got sick and said the lack of paid sick leave makes workers hesitant to report their illnesses.
From the moment a worker gets sick and stops working, he doesn't get anything.
Community health worker Soraya Leone says there are also issues with access to clinics and the cost of care. Immigration status also plays a role in workers not getting tested.
Undocumented people, they don't say anything because they are afraid all the time.
Zach Riley with the Colorado Livestock Association says the industry has been a crucial partner with state officials in protecting animal and worker health.
There's been multiple free resources provided by the state and by employers to try to make sure that you are protected. I would say you would be hard pressed to find somebody not doing it.
I mean, we did speak to some farm workers who said without the help of these nonprofit organizations might not have had the information or the PPE at their disposal.
I would venture to guess that's a very limited case and very limited number of those. Any one of our producers would gladly tell you they're offering a whole treasure trove of things to their employees.
But despite efforts to reach out to several different cattle organizations, including Riley's, we couldn't find a Colorado dairy farmer to speak with us, some citing concerns around the potential spread of bird flu. In November, research from Colorado and Michigan confirmed what many people suspected. Antibody tests showed more farm workers had signs of previous bird flu infections.
That is not uncommon when it comes to infectious diseases because not everyone gets tested, but it does tell us that we still have work to do to protect humans from exposure.
Back at El Centenario Mexican restaurant, this dairy worker agreed that more support is needed.
Most people who work on dairy farms, most of us lack someone to tell us what guarantees we have. We are really lacking information.
While there haven't been recent cases of bird flu in Colorado dairy herds, the virus is continuing to spread widely in California cows. Earlier this month, federal ag regulators took Colorado's lead and announced mandatory milk testing for the first time, an acknowledgement that we are still a long ways from getting a handle on the spread of this disease. For the PBS NewsHour, I'm Stephanie Tsai in Weld County, Colorado.